is a non-invasive solution for those who see their double chin as a problem area. Take a look at Stephanie's story.
Okay. Come on in, Stephanie. Come on around.
So my name is Stephanie. I'm 36 years old. This double chin has bothered me for a long time, so I'm really looking forward to having the neck lift today.
Go ahead and lie right back.
It's something that's been in my family genetically. My mom has it, my grandma has it, and I had a baby a few years ago, so now it's time to look after me. The weight's coming off everywhere else, but this is not coming off.
So let's just jump right in. We're going to do some Belkyra today, like Botox for your double chin and make it go away.
Perfect.
Okay?
Yeah.
Let's get going. What we're seeing today is extremely common, the ubiquitous double chin. It affects even the thinnest of women. Sometimes will have a double chin they just can't target through diet and exercise. So the actual injection itself into that waddle, into that unwanted fat, is not terribly uncomfortable because it's a very small needle, but the chemical itself breaks down the fat, and you'll feel a little bit of burning. In fact, I tell patients, if you don't feel the burning, it's not working. The burning's good. It's killing your fat. I mean, there's two types of double chin. Double chin with good skin tone, then we've got all kinds of options to melt the fat non-surgically. Belkyra is very popular. We're going to see that today. And there's some other energy devices that melt a little bit of fat, but you need good skin, because if you melt the fat and the skin's all wiggly jiggly, it looks worse. Not too much pain, you agree?
No, it's
not
fine.
Pain. It's actually easier than Botox. And then there'll be kind of a bruise discomfort over the next week or two. You probably won't see any bruises, and it'll feel kind of firm, but that's it.
Okay, perfect.
Stephanie, how are you?
Hi, I'm good. How are you?
You're looking great.
Thank you.
Good. How was your recovery?
It was easy. Yeah.
So you had quite a noticeable waddle, and I would say that's probably a 60%
Yeah.
reduction. Really nice.
Yeah.
So now you've got an angled neck. The jawline looks good too. I'm glad we did that. So at this point, to maintain this nice jawline, weight neutrality.
Yep.
Weight neutrality. Oh, and did I say weight neutrality? So just maintain your weight. This will be forever.
Very dramatic. Very dramatic. Okay, Dr. Steve Mulholland joins us right now in studio. Very cool. The last thing you said to her is maintain that weight and maintain that weight, because if she gains the weight, it's going to go back into those areas.
That's very important. I mean, you can't expect to have fat melted and then put on weight and hope it stays the same.
Right.
So double chins are very frustrating. Many women are in great shape. They work out and they have this hereditary double chin. And now we have a non-surgical solution, a simple injection, and you can melt away years of frustration.
Did she just go in during her lunch break? Like,
Yeah.
how quick was that?
It's one of those lunchtime procedures. It took literally 5 minutes. There's a little bit of swelling, but you already have swelling there. It's a double chin, and so it goes away over a few weeks.
He's a glass half full kind of guy.
Yeah, you got to look on the thinner side. And so it's a very compelling procedure because you avoid liposuction or open neck surgery, and everybody responds to some extent.
Okay, so what was that procedure called? What did you use?
It's called Belkyra. It's a little chemical, a natural chemical your gallbladder will produce. If you walk into McDonald's, you smell some French fries, you
so
release
good.
it immediately.
Okay.
And so it breaks down lipids or fats, and now it's just going after fats that you've already stored neatly tucked away in your double chin.
Okay, any risks or complications
It's
you need
very
to be
few
aware
risks.
of?
That's why it's so compelling. A little bit of bruising or swelling, there's almost no risk. The biggest risk is you're hoping for a right angle neck that you just can't get. It gives a nice, noticeable, modest improvement. And so realistic expectations, and 5 minutes out of your workday, and you can do that.
Okay, so you can see right there, I mean, it's a subtle thing, but it's actually quite dramatic. So if people see her, they'll say something's different. They might not be able to pinpoint exactly what it is. And a lot of people look for that when it comes to cosmetic surgery. They don't necessarily want to look done.
Correct.
They want to look fresher, like they just had a really good long nap, right?
One of the
and
most
things are just
common
better.
comments she would get is, have you lost weight? They wouldn't pinpoint you've done your chin, and she only did 1 round of injections. People can come back and do another round to get another incremental improvement, so it allows you to adjust your double chin.
Okay, so you would only go back if you wanted a little bit more taken off?
Correct.
How long does she get the bruising for after that and the
very few
swelling?
people get bruising because the chin doesn't have a lot of vessels. So bruising is one of the risks. Very few people do. Usually it's a little swollen, no bruising. You go right back to work or take a day off, and you might come back 6 weeks later, assess it, maybe do another round. Usually people get what they want after 2 rounds.
Okay, all right, they're good after 2 rounds. So now she can get her selfie game on point.
Yes.
Like, click, click. You don't get the double chin thing going on.
Selfies have been great for double chins.
Yeah, it has been, eh?